Philippines, kamusta po kayo? I am back. Oh my God. Isang tulog na lang talaga, ano? And then my journey begins. Anyway, kumusta po kayo, mga kapatid, angels in the sick room house, everybody? Good evening po pala dito sa Amerika kung andito man kayo. Okay? And tawag nito, kasasabi ko nga sa previous ko na clip, tomorrow is my trip going to Vegas. And I'll be staying there because I accepted a new assignment. And it will be a 13-week contract. Oh my God. And would you believe na yung travel ko bukas will be 22 hours? Oh my God. Anyway, nakasling po tayo ngayon sa YouTube channel and Instagram, my Facebook, and the Chronicle of Medical Surgical Nursing, and of course, to Nurses Hub Review and Training Center. Today is actually July 17, 2024, my time zone. And it's almost alas 10 na po ng gabi. Ayan, so technically, ang oras mo sa Pilipinas, siguro mga almost 11 ng umaga sa Pilipinas. So good morning sa mga estudyante natin dyan in the Philippines. Good morning. Don't forget and don't skip your lunch. Anyway, I decided to stream tonight, my time, because timely yung aking topic ngayon kasi nga isa sa mga reason na nagkakaroon ng complication yung mga long distance driving, mga ganun po, no, is your deep vein thrombosis or your DVT, which is actually a common question in the NCLEX-RN qualifying examination. So for those who are planning to take your NCLEX-RN, so I hope this will help you guys if you ever encounter questions about deep vein thrombosis. So if you have any questions, anything you want to ask, please feel free not to drop a message or send a private message to me. And then if I have time, I'll try to answer whatever, inquiries you have or any concerns you have. So bakit hindi ko narinig sa kabila? Okay, so let's talk about deep vein thrombosis. Okay, let me share my screen. Okay, here. I don't know if this is a nice setup. I don't know the other one. Okay, give me a minute. Let me check kung okay yung aking pag-stream. Okay. So let's talk about DVT or deep vein thrombosis, okay? Okay, your DVT stands for deep vein thrombosis. Ayan. So when you say DVT, it refers to development of clot or clot formation in the deep veins. So it refers to clot formation in the deep veins or veins. So where do you think are the common sites of your DVT? So there are two common sites of DVT. You have the lower pelvis and the calf. Okay. So common sites. Don't forget this in your NCLEX. Common sites. So you have your lower pelvis and you have your calf. Calf, singular, calves, plural. Okay? Now, what causes DVT? Bakit pa nagkakaroon ng formation of clot or clot formation in the deep veins? So, in the book, the causes of DVT can be referred as your Virchow's or your Virchow's triad. I don't know how you say this, but for me, I used to say it Virchow's triad. Okay, so from the word itself, triad, so technically we can say there are three major causes of your deep vein thrombosis. So let's identify the three causes. First cause of your DVT, okay, is venous stasis. Other book, they don't call it venous stasis. Other book, they call this as what? Impaired venous flow. Okay, or venous stasis. So, kailan lumalabas yung DVT under the venous stasis? I think if you were able to watch my previous stream, I mentioned this immobility. Okay, immobility. So, for those who are immobile, those who are bedridden patients who rarely move, okay, there is risk of clot formation. Kaya nga, you expect that if you're a nurse, to prevent clot formations to our patients who are bedridden, there must be passive range of movement. You need to hydrate the patient. Apart from that, importante dito yung ating prophylaxis. Sometimes we give heparin shot. Sometimes we give Lovenox shot. Or don't forget your SCD, your sequential compression device. Okay, so another thing, not only related to bedridden patients, so mga tao po na who are planning to have a long distance trip or long distance flight. So every 2 hours, meron po tayong tawag nito na pull over, exercise, stretch. You need to promote circulation. Okay, by the way, hello to Jackie Pax and Roxanne Siason. Thanks for watching. Francis Andrew Paduganan. Thanks for watching. And Arj Galika and Jess May Chavez. Son John. Thanks for watching. Okay, and another cause of your DVT under Virchow's triad number 2 is hypercoagulation. What do you mean when you say hypercoagulation? It means to say that the patient has a high risk of clot formation. Now, can you identify conditions that will increase the likelihood of clot development or clot formation? So one good example here is pregnancy. Pregnancy. Remember, if you're pregnant, there is what we call physiologic changes in pregnancy, that there's increased clot development. That is why we discourage you giving massage to pregnant mothers, especially sa lower extremities, kasi nga there is clot formation. So the danger with your clot formation is that when you massage and then accidentally na-dislodge yung clot, it turns to become an emboli. And if that clot or emboli enters the lungs, there is a likelihood of pulmonary embolism. Or if it enters the brain, there is always a risk of stroke. Okay, so a lot of problems or concerns, okay, na pwede mangyari pag na-dislodge yung clot. Okay, next, another condition that could increase the clot formation of your patient is if you are dehydrated. So dehydration. Do you know that if you're dehydrated, it makes the blood viscous? It makes the blood, okay, viscous, sabi nga natin, malapot, increasing the risk of clot formation. Kaya nga, one management or preventive measures to prevent clot formation is to dilute the blood out. So how are we going to dilute the blood? Tell the patient to drink a lot of water. That is why hydration is important. Uminom po tayo ng maraming tubig. Okay? Uminom ng maraming tubig to dilute the blood to prevent clot formation. Okay? Yun yung crazy about medical surgical nursing. Why? If you overdo something, it gives you a condition, a problem. If you don't do it, it will give you another concern. Okay, can you think of it? If you drink a lot of water, okay, if you drink a lot of water kasi ayaw mo nga magkaroon ng clot formation, hindi rin okay na uminom ng maraming tubig. Bakit? If you drink too much water and you don't pee, there is fluid overload. If you drink a lot of water and you don't pee, there is a risk that the blood is super diluted, causing hyponatremia. See? So, kung iinom ka ng tubig kasi ayaw mo magka-clot, uminom ka ng maraming tubig, it gives you another problem. Hindi ka namatay sa clot, namatay ka naman sa fluid overload. That is why, in medical surgical nursing, okay, everything must come in moderation. Okay, dapat alam natin yung pros and cons. This is one concern in medical surgical nursing question, because if you overdo the management, that gives you one problem. If you don't do the management, of course, it will give you another concern. Okay, so that's dehydration. So hydrate to prevent clot formation. Next, another concern that will increase your likelihood to have DVT under hypercoagulation is a patient with increased platelet count. Okay, remember your platelet is a component of your blood that will prevent bleeding. So if there's too much platelet in the body, what do you call that condition? You call that condition as your thrombocytosis, right? So thrombocytosis is a medical term that describes increased platelet count. Okay, kung pag masyado maraming platelet, so magkakaroon ka ng risk of clot development. Okay, not only thrombocytosis, okay? Pag masyado maraming RBC, WBC platelet, now what do you call that blood disorder characterized by an increase in your blood cell component? It is a form of a myeloproliferative disorder. Okay, you call that condition as your polycythemia vera. Okay, you call that as your polycythemia vera. So what is polycythemia vera? Polycythemia vera is a chronic myeloproliferative disorder involving all bone marrow elements. So basically what happens in your polycythemia vera is that there is an elevated RBC count, okay, elevated RBC count, elevated WBC count, and an elevated platelet count. Okay, I already mentioned if there's too much platelet in the body, okay, you call it your thrombocytosis, it increases clot formation. Much more if there is an increase in the RBC and WBC. So what will happen? Pag masyado mataas yung RBC, what is the normal RBC count? The normal RBC count ranges from 4.8 to 5.4 millions per cubic millimeter, correct? What is the normal WBC count? WBC, what is that? 5 to 10,000 per cubic millimeter? Okay, so pag masyado mataas yung blood cell components, that will make the blood viscous. Okay, so if the blood is viscous, what will happen? The more it increases clot formation. Okay, next, another risk of hypercoagulation is a blood disorder called the sickle cell anemia. Okay, your sickle cell anemia is a type of anemia wherein the bone marrow of the patient is producing a defective hemoglobin S. Okay, so what happens is that if you are a patient with sickle cell and got exposed to a low oxygen concentration, low O2 environment, okay, what will happen is that it turns the blood into abnormal blood, okay? Magkakaroon ka ng sickling, and that sickling will increase viscosity of the blood, leading to clot development. So pag may clot development or clot formation na, it will eventually cause obstruction in your circulation. Kaya nga, one complication of sickle cell anemia is your vaso-occlusive crisis. You also call this as your sickle cell crisis. So if you come to think of it, okay, nag-stem siya sa decreased oxygen, okay, in the environment. So having said that, in your NCLEX, don't forget, if a patient has a sickle cell anemia, tell your patient not to go to high altitude places, because a high altitude area has a low oxygen concentration. So if you go there in an environment has a low O2 concentration, or O2 less than 21% oxygen concentration, it will trigger the blood, okay, to have an abnormality, causing the RBC now to sickle, causing, pag nag-sickle, I said there will be increased viscosity leading to clot development. So pag maging viscous na siya, magiging malapot siya, magkakaroon ka ng clot. Kaya nga, to prevent that, you have to hydrate your patient. Now, if you incorporate this in NCLEX, ang common tinatanong dito, ano uunahin mo, Sir John? Will you give oxygen, then you hydrate the patient, or you hydrate first and then you give oxygen? Okay, so what do you think is the best answer? The best answer here is you have to hydrate your patient first. Hydration first, then after that, followed by O2 supplementation. Why? Remember that the blood of the patient is viscous, correct? If the blood is viscous, increased viscosity of the blood has a poor oxygen adhesion. Hindi po didikit ng maayos yung oxygen molecules if the blood is viscous, if the patient is dehydrated. That is why, what will you do? Hydrate the patient first, and then after that, that's the time we do O2 supplementation. I hope that's clear. And that is a common question in your NCLEX, okay? So these are common concerns or conditions, medical conditions that will increase the likelihood of the patient to have clot development or clot formation. Take note, we're talking about the causes of your DVT. We're still number two, hypercoagulation. Okay, next, number three. Another cause of your DVT under Virchow's triad is your blood vessel injury. Blood vessel wall injury. Okay, so any injury in the blood vessel wall, there is always a risk, okay, of your clot development. Most likely here, example na lang natin dito. One good example here is your burn injury. Remember burns? Burns refers to tissue death or cell death brought about by exposure to extreme heat. So it causes injury to your blood vessel wall. Kaya kung napansin nyo, sa burn injury, because injured yung blood vessel wall, there is fluid shifting. Okay? There is edema formation for burn injury because of what do you call this, damage in the blood vessel wall of the patient. Okay, so these are three causes of your DVT under Virchow's triad. So sometimes in your NCLEX, tinatanong ito, select all that apply. So don't forget the causes of DVT. Simplified lang natin Virchow's triad. And what are this Virchow's triad? The causes: you have the venous stasis, you have your hypercoagulopathy or hypercoagulation, and third is your blood vessel injury. So we're done talking about this, okay, the causes of DVT. Let's proceed to patient signs and symptoms. Okay, so what are common signs and symptoms of a patient with deep vein thrombosis? Okay, one common manifestation here is that there is what we call intermittent claudication. Intermittent claudication. So what is intermittent claudication? This is a term that describes patients complaining pain, okay, when the patient moves, when the patient walks. So ibig sabihin, pag naglalakad yung pasyente, naglalakad siya, there's mobility, there's increased mobility, okay, the patient will complain pain on that affected area. Okay, pain aggravated by movement, pain aggravated by walking. But when the patient stops walking, if the patient is at rest, the pain disappears. So that is the characteristic of intermittent claudication. Now, a common question in your NCLEX here about intermittent claudication is that what's the most appropriate nursing diagnosis? Don't forget the answer there will be what? Okay, the most appropriate nursing diagnosis here is, okay, altered or impaired tissue perfusion. Okay, altered tissue perfusion. Anyway, may nagpapabati. Hello, ang dami na. Bakit nanonood kayo sa Pilipinas? Ha? Alas 11 ngayon, wala ba kayong trabaho? I was expecting that you will watch this later on. Anyway, hello to Jessa Bakot, Wendy Kim, Dagok, hi to Peebles, Ramos, Niza, Albi, Saviera, Arienza, and Nortesa Andaya, and Gulen Marie Empresa. Thanks for watching. Anyway, so you have your intermittent claudication. Another manifestation of patient with DVT, there is swelling. Okay, there is swelling on the affected extremity. I will not forget this because I have a patient a few months ago who is having sickle cell anemia and is complaining of swelling on his arm. Okay, not her arm, kasi babae siya. She complains of swelling on her arm. So all the while we were thinking, ano lang yan, swelling at saka pain sa left arm niya. So all the while we were thinking, nagsistick lang siya ng pain medication. So eventually when we did the ultrasound, okay, they found out that there is clot, okay, dun sa arm ng pasyente. So because of, patient was complaining pain and swelling. Hello to Eli Tips. Thanks for watching. So that's number two. Another manifestation of your patient, of course, patient with DVT will have positive for Hohmann's sign. Hohmann's sign. Positive for Hohmann's sign. What is positive for Hohmann's sign? If you dorsiflex, okay, if you dorsiflex the foot of the patient, there is pain. Okay, that is your Hohmann's sign. But let me remind you, not all patients with DVT will end up having positive for Hohmann's sign. Why? Because a positive Hohmann's sign, dependent po yan kung gaano kalaki yung clot. The bigger the clot, then the most likely you'll be able to elicit Hohmann's sign. If the clot is so small, so most likely hindi siya makapag-elicit ng Hohmann's sign. Okay? Next, number 4, if you try to feel the skin of the patient is actually warm to touch. warm to touch. Why? Because of impaired venous flow. Remember, the obstruction happens in the in the venous area, in the vein. If you can still remember in our topic the other day, in my stream the other day, I said the direction of blood flow in your vein is back to the heart. So if there's obstruction in the okay, if there's obstruction in the vein, not the heart, if there's obstruction in the vein, there is less blood that goes back to the heart. So blood congests in the lower part, okay, proximal to the obstructed vein, so that can cause warm skin to touch. So kailan ka makakaroon ng cold skin to touch? Cold skin to touch is prominent to patient if the occlusion happens in the artery. So if it's an arterial occlusion, okay, you will most likely have cold skin to touch. If it is vein occlusion, most likely you have warm skin to touch. Kaya nga positioning is different. Okay, if you were my students a review a few years ago, or was my student before, remember I gave you a mnemonic about Dave. I hope this is clear, guys. Dave is the mnemonic I made about positioning for patient with vascular occlusion. So what is Dave? It's a mnemonic. Okay, A for an artery, V for your vein. So if the occlusion happens in the artery, you position, dangle the extremity, dangle the affected part. Why will you dangle? To promote blood flow. Okay, if the occlusion happens in the vein of the patient, is E, that's elevate. Okay, so why will you elevate if the occlusion happens? Okay, if the occlusion happens in the vein, to promote, okay, flow, okay, going back to the heart. So remember, an artery carries blood away from the heart. A vein carries blood back to the heart. So the mnemonic I made here is your Dave. So dangle for an artery, vein, you elevate. I hope that's clear. Anyway, so the skin of the patient is warm to touch. Okay. And then what else? Number 5. Okay. So you will have engorged veins, or distended superficial veins. Distended or engorged superficial veins, all related to what we call venous occlusion. So ang tandaan dito sa NCLEX, itong tatlo. Okay, these 3. Don't forget this in your NCLEX. So these are common manifestations of patient with deep vein thrombosis. Okay, so how do doctors diagnose DVT? Okay, so how do they diagnose DVT? What are the diagnostic tests? Okay, number 1, usually they will do the dimers test. Okay, the dimers test. Remember, an increase in your D-dimer will increase your likelihood to have clot formation. Okay? So, ang D-dimer, pag elevated siya, okay, the usual result, okay? Anong result? Result, pag elevated siya, okay, elevated result means, okay, risk of clot formation. Now, hindi lang po ginagawa ang D-dimer if you want to check DVT. Pwede rin pong ginagawa din po yung D-dimer if doctors want to check risk of pulmonary embolism. Okay? So kailan siya ginagawa yung D-dimer to check DVT, okay? Ginagawa din po yung D-dimer for pulmonary embolism, okay? Ginagawa din po yung D-dimer for patient with cerebrovascular accident, okay? At pwede rin po ginagamit yung D-dimer if you want to check DIC. What is DIC? Disseminated intravascular coagulation. By the way, your DIC, or disseminated intravascular coagulation, it is both bleeding problem and clotting problem. Okay? By the way, the most common reason why DIC happens is septicemia. Okay? So don't forget that in your NCLEX. Septicemia is the most common cause of your DIC, or disseminated intravascular coagulation. Next, number 2, okay, another test that can be done if doctors suspect DVT is an ultrasound. Okay, an ultrasound. You should a Doppler ultrasound. So doctors would check venous Doppler ultrasound in your upper extremities, or venous Doppler ultrasound in the lower extremities for presence of clot. Okay. Number 3, remember, doctors may also do MRI, or magnetic resonance imaging, especially if they want to check presence of clot in the lower pelvis. okay, in the lower abdomen, in the lower pelvis. Remember, the MRI is not using radiation. It does not have radiation. Okay, what they use in the MRI is a magnetic field. That is why if you're a nurse, don't forget that patient scheduled for MRI, no metals allowed, no prosthesis, okay, no pacemaker. But take note, may mga pacemaker po tayo na compatible for MRI. That is why dapat alaman natin the manufacturer of pacemaker and what type of pacemaker. Don't worry, no, if your patient scheduled for MRI, meron po tayong MRI checklist, okay, na complete before we send the patient for the MRI examination. Okay, now what else? Another thing, what if the patient is claustrophobic for MRI, or patient is claustrophobic in general? Is MRI contraindicated? No, we can still do MRI even if the patient is claustrophobic. What we usually do in the hospital is we talk to the doctor and we ask for sedation. So we sedate the patient just to do the MRI. Okay, what else? So these are just common tests done for patients suspected with DVT. Let's proceed to your management. Okay? Bilis ko ngayon ah. Okay. So what will be the management? Okay, management for patient with DVT. Okay, number one, okay, importante dito yung ating hydration. Okay, already mentioned this. Hydration is essential because remember I said if you hydrate the patient, it decreases the risk of clot formation. Number two, medicine. So this is the thing that I need to emphasize for your examination. Now, what are common meds given to your patient? So number one, or letter A, doctors may prescribe aspirin. Okay, now don't forget your aspirin is a form of salicylate. Okay, your aspirin is a form of salicylate. Now, what is the classification of your aspirin? Your aspirin is actually an analgesic. Ano ba yan? Binibigay natin yan for pain. Your aspirin is also a form of antiplatelet. Okay? Do not forget this. Your aspirin is not an anticoagulant. Your aspirin is a form of an antiplatelet. So what is the difference between antiplatelet and anticoagulant? Your anticoagulant prevents clot formation. Your antiplatelet prevents platelet to form a clot. Okay, so I hope that's clear. So anong dapat tandaan sa aspirin? Don't forget that aspirin is gastric irritant. So having said that, aspirin must be taken with meal or in full stomach, again, because it is a gastric irritant. Now, if your patient takes aspirin, what do you think is the best diagnostic test that you need to closely monitor for patient taking aspirin? Answer there is your platelet count. Okay, so you have to monitor your platelet. That's for your aspirin. Since aspirin is an antiplatelet, you need to watch out for bleeding. Yes. Now, can doctors do surgery or perform invasive procedure for patient taking aspirin? No, you have to stop taking aspirin prior to that invasive procedure. So, ang tanong, when will you discontinue aspirin? You need to discontinue aspirin 2 days. Okay, 2 days prior to surgery. Okay, so that will be 48 hours prior to surgery. Okay, but sometimes sa hospital, hindi masyado siya fina-follow. Okay, so depende talaga sa doktor. No? But in your examination, don't forget, stop taking aspirin 2 days or 48 hours prior to surgery. Okay, next, another thing. Okay, another medication given to your patient is an anticoagulant. Okay, remember I said anticoagulant is different from your antiplatelet. An anticoagulant is a medicine that prevents clot formation. Okay, same thing, an anticoagulant can cause bleeding, so you have to watch out. Okay, patient taking anticoagulant and needs to have an invasive procedure because you have to stop this anticoagulant prior to that surgery. So give me an example of an anticoagulant. Example here is your heparin. Okay, heparin is an anticoagulant. Tandaan sa examination. Your heparin is safe, okay, can be given, okay, may be given to pregnant. Okay, is it safe to give, okay, heparin to pregnant? Yes, it's safe. Why? Your heparin cannot pass the placenta. Okay, it's okay to give heparin to pregnant because it's okay, it cannot pass the placenta. Okay, next, if your patient takes heparin, what do you think is the route of heparin administration? Your heparin may be given intravenously or it may be given subcutaneously. Okay, so it can be given IV, it can be given sub-Q. Okay, highlight in your examination. There is a low molecular heparin. Okay, it is a form of a low molecular, okay, heparin that is only given sub-Q. Okay, we cannot give this IV. Now, what do you call that low molecular heparin? Okay, that is only given subcutaneously. You call that as your enoxaparin, enoxaparin, or call this as your Lovenox. Okay, don't forget this in your NCLEX. Your enoxaparin or Lovenox is only given subcutaneously, not intravenously. Okay, it's a type of a low molecular heparin. Next, if your patient takes heparin, okay, if your patient takes heparin, what do you think is the best diagnostic test? Okay, best diagnostic test. What do you think? What do you think is the first and the second answer in your examination? Okay, remember your technique here is your word heparin, correct? Heparin, heparin. If heparin ang technique, how will it guide me to answer the examination? Remember, heparin starts with letter H, correct? If you put P prior to H, it looks like what? It looks like PTT, correct? So the best answer here is your PTT. Okay, your PTT. That's the first answer in your examination. So if your patient takes heparin, closely monitor the patient's PTT level. What is PTT? PTT stands for what? Partial thromboplastin time. Okay, your partial thromboplastin time. If you cannot find PTT in your examination, the second answer is your clotting time. Clotting time. Okay? Now, don't forget this in your examination. May bago po tayo ngayon. Okay, may bago tayo. This is better than clotting time, better than PTT. Meron tayong ginagamit ngayon na, okay, heparin anti, okay, XA. Okay? So, heparin anti-XA. So, this is, sabi nila, mas maganda daw to sa PTT, mas maganda daw siya sa clotting time. But anyway, nabagit natin, first option, first answer is your PTT. Now, anong dapat tandaan sa examination? If your patient is taking anticoagulant, okay, you have to check the therapeutic level. Okay, don't forget this. Your therapeutic level is 2 to 2.5 times higher than the normal level. Okay, so that is why if you're the nurse taking good care of patient with heparin drip, we always check the PTT level of your patient. Closely monitor the therapeutic level of your PTT. So we don't use the normal, we use the therapeutic level. And again, the therapeutic level is 2 to 2.5 times higher than the normal level. Okay, next, if your patient takes heparin and develops develops toxicity, what do you think is the antidote? What is the antidote of your heparin? The antidote of heparin is your protamine or your protamine sulfate. Trivia. Do you know that protamine sulfate is derived from sperm cell of a fish? Would you believe that? Derived from fish sperm cell. One common example of fish they use is salmon. Okay? Sperm cell of a salmon. Okay, or salmon. Okay, protamine sulfate. Okay, now I mentioned that heparin can cause bleeding because it's an anticoagulant. When will you discontinue heparin prior to surgery or prior to an invasive procedure? Okay, so you have to discontinue heparin 1 day, okay, 1 day prior to surgery. A day prior to surgery. Okay, so don't forget this. Aspirin, stop taking this drug 2 days prior to surgery. Heparin, stop taking this medicine a day prior to surgery. Okay, I hope that's clear. Next, another example of of your anticoagulant is your warfarin. You also call warfarin as your Coumadin. Okay, now we mentioned that heparin is safe for pregnant. What about your Coumadin? No, big no, not safe for pregnant. Okay, next, what do you think is the route of warfarin administration? Warfarin is given per RM. It's given PO. Okay, it's given PO. It's a pill. Okay, next, if your patient takes warfarin, what do you think is the best diagnostic test? Okay, what is the best diagnostic test that will evaluate therapeutic level of your warfarin? Okay, so what is the first answer and what is the second answer? Oh my God, that's my washing machine. Okay. The first answer is PT. That's your prothrombin time. Okay. Pag wala ka makitang prothrombin time, the second answer is your INR. Okay. INR. Same thing. Okay. Use the therapeutic level, not the normal level. I said the therapeutic level is 2 to 2.5 times higher than the normal level. Okay. Next, if your patient is taking warfarin, okay, what do you think is the antidote of your warfarin? If the patient develops toxicity, overdosage of warfarin, what medication is given to neutralize warfarin? The answer there is your vitamin K. Vitamin K, your Menadion or Aquamephyton. Remember, when you give vitamin K to patient taking warfarin, it takes 24 hours for vitamin K to effect. And take note, where is the source of your vitamin K? Ano ba yung best source ng vitamin K? Usually the best source ng mga vitamin K best source ng vitamin K natin are green leafy vegetables. That is why tell your patients who are taking warfarin to avoid green leafy vegetables, because if you eat green vegetables and you're taking warfarin, it will render your warfarin ineffective. Okay? And just like your heparin and aspirin, we have to stop warfarin prior to surgery. So tell me, when will you discontinue warfarin prior to surgery? Remember, warfarin starts with what letter? Letter W. Okay? So that's your technique. W for week. So discontinue warfarin 1 week. Okay? Remember, that's your technique. W, warfarin week. So 1 week prior to surgery. Okay, I hope this is clear. So take note, aspirin, discontinue aspirin 2 days prior to surgery. Heparin, discontinue 1 day prior to surgery. Warfarin or Coumadin, discontinue a week or 1 week prior to surgery. So these are common meds given to your patient. Okay, apart from your medicine management, okay, third management for patient with DVT is your filter placement. Filter placement. So usually doctors will place IVC filter. What is IVC? It's your inferior vena cava filter. Okay, so they will put a filter in the inferior vena cava to trap the thrombus, to prevent that clot to get inside, okay, the lungs of your patient, ending what? Pulmonary embolism. So, have you seen, I'm not sure if you're familiar with this, have you seen yung pang-massage sa scalp? Yung parang may wire siya na may ganito siya na mukha na nilalagay sa scalp to pang mamassage sa scalp. It looks like that. Okay, check natin. Let me see. IVC filter image. Okay. Let me see here. This one. Ano to? So this one, I hope this is clear. So this is your IVC filter, your inferior vena cava filter. Di ba tinan mo yung sinasabi ko na parang pumasan sa scalp? Okay, it looks like that. So it will trap the clot, preventing that clot to get inside the lungs, preventing it to cause pulmonary embolism. Okay? Hanap tayo na mas malaki na ano. Tagalin natin yung complication. Filter lang. Here. Oh, this one. So this is your, I'm not sure if you can see this one. So this is your IVC filter. Nilalagay siya sa inferior vena cava. Okay, so in your, of course, in your abdominal areas, vena cava, okay, to prevent the clot. So that's one management. Okay? Ginagamit yan, ginagawa yan sa mga pasyente, lalo na patients who cannot take anticoagulant, okay, or anticoagulant medicine. Next, another management, nahanap ko, nasa aking whiteboard. Here. Okay, so you have your IVC filter. And number four, okay, number four, other management here is surgery. Okay, what's surgery? Surgery usually last resort na to ng mga doktor. They may do embolectomy. Embolectomy is removal of the emboli, removal of the clot, usually done in an emergency condition wherein there is occlusion, no? Complete occlusion sa circulation ng pasyente. So we really have to do the surgery, removal of the clot, or thrombectomy, removal of the thrombus. Sir, what is the difference between thrombus and emboli? Okay, pareho silang clot. Okay, so ibig sabihin, if this is your blood vessel and there is a clot here, okay, a clot na nag-adhere sa wall ng blood vessel, you call that as your thrombus. Okay, a clot. Once, okay, na-rip yung thrombus and then natanggal siya at nagsa-circulate siya, nagwa-wander sa katawan, okay, you call that as an emboli. Okay, so an emboli can be a part of a thrombus that nag-dislodge, okay, and then it is now wandering, traveling, okay, inside the body. So the danger with your emboli is that since it's freely moving inside the circulation, there's a risk that it will lodge in the brain, causing stroke. It may get inside the heart, causing pulmonary embolism. Okay, so these are two common surgeries done to patient apart from your IVC filter placement. Okay, so done with the management, let's focus with the nursing responsibilities, which is the highlight of this concept. Okay, number one, don't forget this. A patient with DVT, okay, a patient with DVT, I mentioned hydration. Okay, number two, a patient with DVT or deep vein thrombosis, don't forget this. You need to promote circulation, okay, and good perfusion. Okay, promote circulation and good perfusion. How? Okay, letter A, okay, don't forget this. You need to elevate the affected part. Letter B, take note, do not massage. Okay, do not massage and do not apply compression. Okay, question. Sir, as a preventive measurement, as a preventive action, okay, can we apply compression? Yes, we can. But if yung patient po ay may DVT na, we no longer advise compression. I hope that is clear. Okay, next. Letter C. Okay, how will you promote circulation and perfusion? Okay, letter C, don't forget sa parts. Okay, here, affected. Here, unaffected. Okay, how will you promote circulation sa affected extremity? To promote perfusion, circulation sa affected extremity, I said elevate. Okay, how will you promote circulation and perfusion to your unaffected? Okay, there must be range of movement. Okay, range of movement. Okay, now, sir, Pag sinabi kong range of movement, okay, idagdag natin yan dito. So pag sinabi kong movement, okay, you need to promote what? You need to promote isometric movement. Now, what is isometric movement? What is the difference between isotonic movement and isometric? No. Hello to Hannah Medina. Hello to Alina Lamis. Oy, Alina. Oh, saan ka na? So anyway, hello to Isa Narveson. Love your reviews. Thanks a lot. So let's go back. So what is the difference between isometric and isotonic movement? Pareho silang movement, may difference sila. Ano yun? So look, if I flex my arm, okay, if I do this is an example of your isotonic movement. Okay, isotonic movement. If I'm going to push the wall, okay, I'm going to push the wall, that is an example of your isometric movement. So anong difference? Pareho silang may muscle contraction. Am I right? So pareho silang may muscle contraction. Remember, if I flex my arm, the muscles contract. Okay? If I push the wall, the muscles contract. Ang difference lang, yung isa may flexion, yung isa wala. Okay? So how will you encourage isometric movement to a patient? Simple. You tell your patient, can you push your heel, okay, the heel of your foot against the mattress. So ibig sabihin, if this is the foot of your patient, and then, hold on. Let's say this is the mattress of the patient, okay? Mattress of the patient. If the patient push his or heel against the mattress, it can cause contraction of the muscles, the gastrocnemius muscles, the muscles in the lower extremities. So as the muscles contract, remember, when muscles contract, they will squeeze the blood vessels. So as the blood vessels are squeezed, it will propel the blood back to the heart. It promotes circulation. So ibig sabihin, muscles contract or muscle contraction, okay, aid in circulation. Okay, so it helps a lot when you move. It helps a lot when muscles contract. Because again, when muscles contract, they will squeeze the blood vessels, propelling the blood back to the heart. Good circulation will also lead to good perfusion. Okay, that is your isometric. Again, how will you encourage isometric? Tell your patient to push your heel against the mattress. Another example is if you push the wall. Remember, if you push the wall, the muscles contract pero walang flexion. That is your isometric. But if there is great degree of flexion at merong muscle contraction, ang tawag sa movement na yon ay isotonic movement. So I hope you understand the difference between isotonic movement and isometric movement. Okay, next, part of your management here, letter D, is to apply warm compression. Warm compression. Where will you apply warm compression? Will you apply it on the affected extremity? Unaffected extremity? Where? Answer here, apply warm compression where? In the lower abdomen. Why will you apply warm compression in the lower abdomen? Applying warm compression in the lower abdomen will give you a systemic vasodilation effect. So when the blood vessels dilate, it will promote blood flow. It will promote circulation. Okay? And of course, letter E is tell the patient wear an anti-emboli stocking. Okay, another highlight in your examination. So when is the best time to wear an anti-emboli stocking? The answer in NCLEX is wear an anti-emboli stocking when? Okay, before rising up from bed. Okay, in the morning before rising up from bed. Hindi po pwede na nakatayo ka na, tumayo ka na from your bed, tapos i-wear mo yung stocking. The purpose of wearing the stocking before rising up from bed is to prevent the blood, okay, to congest in the lower extremities. So you have to wear the stocking first before standing. Okay, so that's the reason why. Well, okay, let's see if we have any questions. Kung wala, that will be great. Somebody's asking here, Jessie Marie L. Ramos, office please. Sorry, nasa Amerika pa ako ngayon. But we have office in Iloilo City for the Nurses Review Center. So that is the, what do you call this? That is your Nurses Hub Review and Training Center. Who else? Who do we have here? Ella Dicanio, thanks for watching. Elmer Amper, thanks for watching. Hannah Medina. Mariho Capus, thanks for watching, guys. Nanonood lang kayo, wala kayong mga tanong ha. Maayos kayo. Anyway, if you don't have questions, thank you so much. I hope you learned something, guys. Okay, so thank you so much for watching. Please pray for my safe trip tomorrow to Vegas. So magmamaneho ako from Minneapolis to Las Vegas alone. So it's a 22-hour trip. Thanks a lot, guys. Hope you learned something. God bless everybody. Stay safe.